All right, let's do this. Yeah, it's still swollen.
Okay, that was, well, I guess that's, yeah, that's where the hole was. I was going to say that was a little tender.
Yeah, this usually is tender for a while.
Yeah.
It's going to be tender. It takes several weeks for that to gradually quite take. Bend the knee up as far as you can. All the way.
Right there. And again, it's actually it's kind of, yeah, it's probably more the hole than it is anything else.
Pretty good. 20 degrees, which is about what most people have at this stage. And bend up again for me. Okay. How's that feel?
Good.
Excellent. A little tender there.
Yeah. Yeah.
How's
right
that feel?
That one doesn't hurt. Yeah.
Okay. Down here feel okay?
Yeah.
All right. Hold it up nice and straight for me. Good. All right.
Yeah, I've been doing the exercises at least twice a day.
That's good. No, it looks good. Here's your
So
kneecap. So this is some arthritic area under your kneecap. The cartilage should be real smooth. These little frames of cartilage here. That's some degenerative change. Another view of it right there. It should be nice and smooth, and this isn't.
Yeah.
Now this is the inside. This is the medial femoral condyle. Again, see how irregular it is?
Yeah.
It should be, again, nice and smooth like a pool cue ball. It's not. Here's part of the meniscus, the medial meniscus over here.
Yeah.
This is the front of the knee up in this area.
Now that's what's still left?
Yeah, I didn't touch that.
Okay.
And here again, you see, this is the tibia surface, the lower leg bone, joint surface, and again the cartilage is worn down here, it's worn down there. So you have some significant arthritis in the inside of the knee. The meniscus here is beginning right around there.
Yeah. Now, I don't remember a whole lot from when you woke me back up, but did I remember that you took your tool and pushed it into the top of my tibia, showing that it was soft?
Yeah, I think on the outside I might have done that. Yeah. Well, we'll see that.
Okay.
See how this is all torn. This isn't like that nice sharp edge in the front.
Oh yeah.
That's where all the meniscal tear was. And it was pretty well torn there.
Well, it's even more sharper than on the MRI.
And this is where the meniscus attaches, way in the back of the knee.
Yeah.
This is the way and I was able to resect all of this. That needed to be taken out too. This piece was flipped behind. So there's a fair amount, pretty large piece there. See this piece here?
Yeah.
This is called the intercondylar notch, and the back of the knee is through here, and this whole piece was flipped backwards, and I pulled it out. And that needed to be all resected as well. And you can see this is all abnormal. The meniscus is here, and this is a piece that was flipped up. And this is way in back of the knee. So I'm looking back, and here again, this is all abnormal. This is the back capsule behind the knee, and this is the meniscus that's all torn. And here again, there's got a lot of pictures for you, because I know you like pictures. And that's after I removed it. So that piece is now gone. You see how you don't see that there anymore, and that whole piece was removed. That came out nice. And here was the area that was resected up in the front. So the meniscus was torn here, and it was flipped back in here. And I took all the torn stuff out, smoothed off the joint surfaces, but you still have a fair amount of arthritis here. And here. And that can't be fixed, but you should do quite a bit better.
Yeah.
And again, here's just another showing what the arthritis looked like. Here's your ACL. It looked good. Nice and normal. And here's the lateral compartment. The meniscus was fine. The femoral, the thigh bone joint surface looks good. The meniscus is over here. It's right at the edge of it, nice and sharp all around. It's a probe. And I think it was here. Everything looks pretty good. There are only some slight arthritic change, but here's the probe. It's about 5 millimeters from here to here.
Yeah.
I'm lying on the surface with it, and then it shows how it goes into the surface, because the joint cartilage here was soft. It shouldn't be. It should be like a drum.
Yeah.
It was soft. So there is some arthritis here. Nothing you need to do about it. So that's pretty much it.
So
that's the story.
Am I good to at least say go on the exercise bike now and
I think I'd give it time for that to quiet down.
a little more?
Yeah.
Okay.
I would. I would let that. I would let that soft tissue swelling go down a little bit more. I keep the icing. I keep the leg lifts. I would not do any aerobic exercise with this right now. It's stronger enough that you want to get your range of motion full, which it's not. So when it gets full, when the swelling's down, the stiff feeling's gone, then I would start to get back on that. Probably another few weeks.
Oh, okay.
And as far as running, not the kind of knee I feel pounding on.
Yeah.
I have a fair amount of arthritis. You gotta do what you gotta do, but I wouldn't, not one I would recommend, say, oh yeah, everything's fine, the 19-year-old with the knee, and
Yeah.
I think that's the problem.
Yeah, I know. Kind of like it. Did you see a $1 Million Baby, Clint Eastwood movie of the boxer?
I
Yeah.
did, yeah.
Yeah, I feel kind of like the woman there that, 64 years old, and this is the one thing that really has brought some kind of happiness into my life. So if I
You're talking
kind
to
of
me,
feel
I'm
like if I don't have this, I have
I'm
nothing.
not telling you not to. I've had 6 of these that I run stuff.
Okay,
So,
all right.
and I run knee pain all the time.
All right,
This surprises me.
okay.
From an orthopedic standpoint, there are degenerative changes in that knee.
All
They're
right.
not going to be helped by pounding on that knee.
You're somebody who understands me. I like that.
That's my thing up there.
Yeah.
I'm sort of a crazy runner too. But
Good.
from that standpoint, is it the kind of knee I think is a great knee to run with? The answer is no.
Yeah. Well, I probably don't have that many years left anyway. Might as well enjoy the ones I got.
I'm not going there. I hope not. But I think you're doing fine. I really
Oh, good.
do. I wouldn't expect anything different at this stage.
Mm-hmm.
And I would just, if you need to use some ibuprofen or something, like I said, the icing, the leg lifts are important to get the range back.
Yeah.
And I'm checking them out to see how things are going.
Okay. All right.
Any
Good.
questions?